On audio. We're going to pause. Okay, I understand we're good now, so I'll continue. The Unified Command Team briefing once again for Thursday, April 23, 2020. I'll begin today with some sad news. We have had our fifth death from COVID-19 in Midland County. A woman in her 70s this morning passed away here at Midland Memorial Hospital. She had been a resident at Midland Medical Lodge. That's all the information that I have to share, but our fifth death this morning. Continuing with some additional numbers, across the state of Texas, we have now 21,000 cases. There have been over 500 deaths in the state and 65 cases here in Midland, and our fifth death today. Here at the hospital, we have a census today of 126. Yesterday, we saw only 82 patients in our emergency department as activity continues at historic lows there. We have 11 critical care patients today, and one of our lowest census numbers of persons under investigation that we've had in a while, only a total of 7. 2 of those in critical care and 5 in medical surgical environments. 5 of those 7 are confirmed positive for COVID-19. We have a number of things to tell you about today. We have opened, as of actually yesterday, to some elective endoscopy procedures. Today we have some elective surgery beginning. We have certified to the state that we will reserve 25% of our bed capacity for COVID-19 patients. As well as making a promise that we will not ask for personal protective equipment from any state or federal agency. Those were requirements that came up in the governor's order that allowed for the resumption of some elective procedures. We will be having regular meetings, probably at least twice a week, with the surgeons and the anesthesia providers and others involved in doing elective procedures. To assess the upcoming schedule, to make sure that we continue to abide by our pledge to keep 25% of our beds available for COVID-19 patients, and to be certain that nothing has occurred in terms of a growth in cases or a depletion of personal protective equipment that would cause us to change those schedules. We've asked our surgeons and our GI doctors and our cardiologists, and especially their patients, to be very patient with us, to remain flexible, and to recognize that this is a fluid situation that could change from day to day, depending on the conditions in the community. With that said, I would like to offer my specific thanks today to those providers, surgeons, gastroenterologists who do endoscopy, cardiologists, anesthesia providers, the whole team in the operating room, nurses and techs, people who do recovery and preoperative work. All of those folks have been off their regular routine for several weeks now. They've filled in other places. They've remained patient. Many of our surgeons have had very little opportunity to earn income during the course of that time. And through all of that, they've remained patient, very rational. They've encouraged us to continue to be careful as we ramp up elective cases. And I can't thank them enough for their professionalism and their attention to the concerns of the whole community. But we are getting started again today, and we'll see how that goes over the next few days. As we get started with elective procedures, there'll be some impact. We have been using the personnel from the operating room and recovery and day surgery and other jobs. One of those important jobs that they've been doing has been helping to man the 6-8 nurse call lines. We've had record numbers of calls, and the call volume really hasn't dropped off a whole lot, but we're going to be taking some of those folks off the nurse call lines and putting them back to work in their regular work areas. And so for a few days while we work on staffing up, if you call 6-8 nurse, you may actually receive a little bit more of a delay than you've had in recent days. We'll correct that delay as soon as we can, but we're beginning to shuffle personnel back to their regular workspaces. So we'll ask you to be patient with the 6-8 nurse line as we transition. Yesterday, you probably saw media reports that we had a positive case that involved a physician. This is someone who has been working in critical care pretty regularly. That physician is home, isolating, self-isolating, has some symptoms, but is at home. We've identified staff members, other physicians, and patients with whom this physician has had contact. We're monitoring those folks for development of symptoms, and will continue to do so. We began that contact tracing 5 days prior to the positive test. So anyone that he had contact with in that time frame, we're tracking down and monitoring. Last thing I will add is that we added some new guidelines for the physician practices that we manage in our community, Premier Physicians and Permian Cardiology and West Texas Orthopedics, all beginning to implement some new guidelines this week that involve continuing to encourage telehealth, but recognizing that many patients cannot get what they need simply from a phone call and need an in-person visit. We're reopening and encouraging patients to come in if they need to, but with some new rules. Careful screening at the time of the appointment and right before they come in to affirm that they don't have symptoms of COVID-19. We're asking people to wait in their cars, and we'll text them when it's time to come in so we don't fill up the waiting rooms and damage our social distancing requirements. We're asking every patient to wear a mask when they come in to see their doctor. We're doing as much registration over the phone as we can do, cleaning the surfaces in each of the offices very carefully, very thoroughly, a wide variety of things intended to maintain social distancing, practice careful hygienic practices, but allow patients to begin to come back and see their doctors as they need to. So those are being rolled out now. We have patients who will begin to come back to the offices. We hope, certainly some people who are anxious and continue to stay at home, and we have telehealth options for them. But for patients who need to come see their doctor, we're going to encourage them to do so. Just the same way we've been encouraging people to come to the emergency department if they have an emergency. If you have chest pain, you need to come to the ED. Don't stay home and allow for it to become worse and delay the care that you need. People who need emergent care should be seeking it in our emergency department. We're there and ready to serve you in a safe and effective manner. So I believe that is all that I have today in terms of prepared comments. I'll be happy to take questions.
Asa, do you have any Facebook questions?
I do.
Okay.
What are your thoughts on the drastic drop in positive cases in Texas yesterday?
I don't have thoughts about the positive case drop in Texas yesterday. I think one of the things that you have to be careful about as you watch those numbers is that there are wide variations in the turnaround time for testing. For example, for us, we haven't received any results for the last 2 days of testing. So if that's applied on a larger scale across the state, that would be an explanation, and it really doesn't mean much.
Do you know when the home tests that were recently approved by the FDA will be available to Midlanders?
There is a home test. I know that one of the commercial lab providers contacted us yesterday to talk about the home test. I think there is some serious concern about the way those tests work. Throughout this process, one of the observations that our providers have made is that the quality of the swab and the sample collection is a very important factor in getting a good, accurate test. The swab process, the nasopharyngeal process is difficult. It's a little painful, and there is some question about whether an individual self-collecting, self-swabbing is going to get a high quality sample. So we're a little bit skeptical about that. The hospital is not going to be offering that home testing. I think it's possible that the local lab providers may be offering it, and that's really all we know about it at this point.
We have a question regarding why Odessa can get the fast COVID-19 test results and Midland doesn't have it. I would really like to know why Midland doesn't have it, and when could Midland receive it?
The two Odessa hospitals have the Abbott point of care testing device, and there were stories a few days ago about the state providing them with a small number of test cartridges that will run on those machines. We do not have that machine in Midland. We have a different machine that can run a relatively rapid turnaround test, but we have not been able to get the test kits and cartridges for that machine in any quantity. So that's basically the facts. The Abbott machine has been somewhat more plagued with accuracy concerns, and we have chosen over time not to acquire that machine, so we don't have it. We can't get it as best we can tell. So we're waiting on a different manufacturer to be able to deliver test cartridges and kits, and we've been slow to get those supplies.
A question regarding the physician that tested positive. When was the last day he was at work?
His last day at work was this past Sunday.
Okay, we have a question from Marfa Public Radio. It's two parts, so I'll ask you the first one and then the second. How many COVID-19 tests are still outstanding from Midland Medical Lodge?
From the medical lodge, it's very few. I didn't look at it. Was 5, I believe, yesterday, but I haven't checked that number this morning. The vast majority of the patients tested at the medical lodge have been resulted. Most of those have been negative, but there were a handful still outstanding as of yesterday.
And the next question is the hospital beginning to see more patients from the nursing home who were originally asymptomatic begin to show serious symptoms?
No, I don't think so. We have a very small number of persons under investigation in the hospital now. That doesn't mean we won't. I mean, clearly there are positive patients who are still isolating at the Midland Medical Lodge, and we're paying attention to that. But so far, they have not gotten worse, and we have not seen a big influx into the hospital.
We have a question from Facebook. Did the 9 physicians that have been tested after the positive doctor have symptoms?
No, they're tested out of concern for the fact that they had contact. We're trying to establish a baseline with those. There are also some employees, I believe, who had similar contacts.
Another question as a follow-up to that, regarding those other physicians that were tested, have those results come in, and are they still working knowing it can be transmitted without showing symptoms?
No, the results are not in. We've tested for the past 2 days and have not received any of those results yet. The issue of healthcare workers continuing to work after an exposure, we've established at the very beginning of this process under guidance from the CDC that workers who have been exposed in the healthcare environment, are potentially exposed, and are showing no symptoms can safely continue to work as long as they're asymptomatic and as long as they wear appropriate PPE. So that's been our practice from the very beginning. We had a large number of employees who were exposed to our very first patient. Those continued to work. A couple of them became symptomatic along the way and were sent home. But our practice continues to be that a simple exposure to a patient without symptoms developing in the worker is not cause to take that worker out of the workforce.
Okay, we don't have any more media questions. So Tasa, if you're good on Facebook, Dr. Wilson, you can come on up.
I have one more question, Erin. Sorry, it just came in. Since they tested out of concern, why not also test the nurses?
I don't know that we're not testing the nurses. I don't have an answer for that. We are testing everyone who's Dr. Wilson's prompting me off camera. We are testing all of the doctors and nurses. I think the doctors were originally tested because they are cohorted together much more closely than the rest of the staff, but we are continuing to test all of the known exposed staff as well. So we're taking care of that. Don't have any results yet. Is that all the questions? Dr. Wilson does not have a presentation today. I'll close the hospital's portion, Erin, and you can hand it off as you see fit. Thank you.
Okay, we have one more question for you, Russell.
Oh, okay, yep.
They're asking about the Easy Rider tests.
Once again, don't have those back yet. We've had, as I said earlier, the turnaround time on testing is sporadic. Sometimes we get them quickly. Sometimes it takes 2 or 3 days. We're in the mode of waiting with over 200 tests outstanding right now, and those tests are among those.
Okay, thank you. We will now turn it over to Whitney Craig with the Health Department.
Good morning. I will give you an update on our numbers currently. We have 67 confirmed cases As far as source of exposure, 13 of those are travel related, 45 are contact to a known case, 9 are from community exposure, and 0 are still under investigation. In regards to our genders, the breakdown is 27 male and 40 female. For age group, we have 6 in 0 to 19, 16 in 20 to 29, 8, 30 to 39, 5, 40 to 49, 9, 50 to 59, 3 in the 60 to 69, 9, 70 to 79, and then 11 in 80 and above. In regards to our patient status, 3 are in the hospital, 16 are in a nursing or rehab facility, 16 are at home isolating, 2 have completed their isolation, 25 are indicated as recovered, and we have 5 deaths. The medical visits are 22 for the drive-through, 11 at the clinic or a provider, 6 for the emergency room, 9 inpatient, 19 in a congregate facility. For the investigation status, we have 45 that are ongoing and 22 that are complete. Update for now. Any
What was
questions?
that last one? Okay. We'll
Oh, no,
go.
so those are my updates.
Let me see what questions come in. Just one second. Okay, from Marfa Public Radio, how has the health department assessed Midland Medical Lodge mitigation efforts? Have y'all just taken the facility's word at face value when it comes to their use of PPE, cleaning, social distancing efforts, or was there some sort of formal assessment when the first coronavirus cases were reported among the nursing home staff?
Okay, that is a good question. Initially, we did have contact with the facility, and that was on a daily basis with several individuals on their administration and management staff. Since then, the Texas Health and Human Services Commission has been in the facility, and they have been in contact with me on a regular basis. They did inform me that they have been impressed with what they've seen at the facility, and they've continued to keep me updated as they are there observing what the staff is doing currently.
Awesome. Is it believed that any residents were exposed to a known case on Easter?
All of our cases associated with the Midland Medical Lodge are going to be considered contact because it is in that enclosed environment that the cases are occurring. For us to say which case was specifically exposed to another case would be difficult, especially if we're narrowing it down to one day, which would be the Easter.
And this is another question. Is it a coincidence that most of these people are women?
I don't think it's really a coincidence. If we're looking at the trends nationally, it does seem to affect women more than men. So we're following the trends that are national trends in regards to gender, male versus female contracting this virus.
All right, let me see if any others come in. Is the Midland Health Department if the Midland Health Department has suspected Midland Medical Lodge staff was not social distancing or using masks and gloves properly, would you have pushed for large scale testing sooner, at least among facility staff?
Yes, our approach was due to the ability for the facility to actually tell us what they were following. They were able to tell us that they were following the Centers for Medicaid Services guidelines. They were able to tell us what CDC protocols and guidelines they were following. So we believe that they were doing what they needed to do. And then when HHSC came in, they confirmed what we were told and what we believed.
From the health department's perspective, since the beginning of April, has it been acceptable for the staff at MML to be hugging patients? Could interpersonal touching like this have spread the virus through the resident population?
Yes, we do want to make sure that social distancing is enforced, and we're told that they are wearing the PPE. And so even with PPE, which is a personal protective equipment, you still want to make sure that you are adhering to social distancing. And if you are, even in this environment, getting close to the residents, it's specifically to provide the service to them. Unfortunately, with the age group of the people that are in these type of facilities, you do create a relationship with them, the workers do. So I'm sure it's probably difficult for them not to be more friendly, more nurturing, but the recommendation is that you still maintain that social distancing, even with PPE.
And this is a Facebook question from Tasa. They asked yesterday regarding sporadic checking different nursing homes and assisted living facilities. Do you think that could be implemented?
I think it's something that would be a great idea in regards to having an idea of what it looks like here in Midland, but it also comes down to the resources. If we don't have the resources to do that randomized testing, then we can only go on what resources we have. So if there is a time in which we are able to get those additional testing kits, then I believe that could be something that could be implemented in the congregate facilities.
And this is from Sammy at News West 9. How are tracing efforts going? How many people have you been in contact with? Who have come in contact with a known case? Ector County says they've reached out to more than 600 people through tracing.
For contact tracing, we've actually been relatively successful in regards to getting the information from the initial case and being able to reach out to their contacts in regards to how many contacts we have. We're probably along the same lines, if not higher than the 600, but I'd say that we're probably right in that wheelhouse along with Ector County.
Are there any precautions being managed in other nursing homes to help make sure this doesn't happen?
Yes, specifically, as it's mentioned, Ashton Lodge, they're an affiliate of Midland Medical Lodge, so they're following the same precautions. They're following the same guidelines. As I mentioned, I believe on Tuesday, we are working to reach out to our nursing homes and make sure that they know what guidelines they should be following, make sure that they know how to access what's necessary in regards to CMS, HHSC, and the CDC, and then make sure they have our contact information so they can always reach out to us, especially if they do have somebody, whether it be a resident or a staff member, that becomes symptomatic and they're questioning what their next steps should be. Did I answer that question?
I think so.
Okay.
And the next question is actually for Dr. Wilson. So we're going to see if he can come back on.
Am I done?
Thank you, Whitney.
All right, thank you.
Hi, good morning. And the question is?
The question was, can we get Dr. Wilson to respond to these answers about the majority of patients being women and sporadic checking of other nursing homes?
Okay, majority of patients being women that have contracted disease could be related to a number of factors that are going to remain in our sort of sorting out things as we move forward. Women, for instance, tend to be the caregivers for children. Children tend to be asymptomatic carriers. There could be so many other factors that play into this to sort out. I suspect in the end of the day, there won't be a higher susceptibility of women. It may be just contact issues or other factors that remain to be investigated and sorted out. The second question is about testing of sporadic testing at care facilities, nursing homes.
Yes.
So I assume the question is related to just doing screening, and this goes back to some of the conversations we've had in the past about testing in general. how is it most effective? And when we have a limited number of tests available, we're focusing on areas where we recognize that there is some disease present. We have done a couple little pilot studies I may have mentioned earlier in some of our conversations, looking at just random admissions to the hospital that were not considered COVID patients and other blocks of patients that are asymptomatic. And we've found no positive tests in those groups of patients that we've done in that capacity. So unless we have a recognized event like we did with Easy Rider, where there were some of the drivers that were infected, and we recognize that they have a central area where they all meet before they go out for driving, we wanted to make sure that those potential contacts were attested. The Midland Medical Lodge had a similar issue. There was a effort, I think, in Odessa to look at Madison, one of their long-term care facilities, and with no disease that they were recognizing in there, and they tested all the residents there, and they were all negative. So I think just in general, to be economical and thoughtful about how we're approaching that, we're going to remain careful and recognize once we see disease in an area, we'll broadly and widely test in that the potential exposure. But sporadic testing, I think, is going to have a very low yield.
And then another Facebook question they ask, do you recommend that those who are experiencing symptoms self-trace?
Self-trace? I think if somebody's infected, recognized COVID infected, professional health department, et cetera, should help work through the contact tracing with them. They may have some ideas about people and certainly let anybody know that they've had contact with. I think that's always a good idea, but by and large, I'd get professional assistance and work through that backwards, because there can be contacts that you may not recall or circumstances, et cetera. So I think it's having the professionals work through that with you is a better idea than just doing it independently.
Thank you, Dr. Wilson.
You're welcome.
And now we will turn it over to Orlando.
Thank you, Erin. Good morning, everyone. I'm Orlando Reddick, Superintendent for Midland ISD, and this is our Midland ISD's portion of the Unified Command Team's COVID update for Thursday, April 23rd. I want to lead off with just 3 different talking points. The first one being the academics and progress monitoring. Hope you're now starting to settle in. A lot of our at-home learning teachers into a routine with your students and their online learning through the Google Classroom. Applause and thanks go out to many of our parents who are doing dual roles, whether it be professionally and working with the student in the classroom or working with the student in the classroom alone. It's been a tremendous effort that they've done in order to support that work. I will tell you, it is messy, it is crazy, it's frustrating, it's everything above, and it's rewarding. And in the end, we will gain what a great reward it is for what parents are doing as their child's first teacher. We've heard from some parents that, the work, it's taking time. And I think one of the things I would recommend to parents is to reach out to the teacher. I'm not asking for more than just a few hours, 3 hours or so of work that's distributed within the day. And if it's taking your child more time to navigate what that learning looks like, reach out to your teacher. Your teacher has office hours, and those hours and timeframes are designed for these type of questions to find out why an assignment might take more time than another, or why my child might be navigating not at the fluid pace that it might take, and it's stretching it out and stretching it out and stretching it out. That's what your teacher is there for, and that's the benefit of the Google Classroom, to recognize what that is and reach out to your teacher in regards to that. If you feel that this is the case, your campus teacher again and your principal are your best contacts, and they can help with the problem if that is one of them. But please communicate with your teacher. That's going to be the best avenue to navigate how that assignment was built and how it was intended to hit the student in regards to the workload, and then return back for feedback. You can track that student's progress, and it's very important that you do this through Skyward. The Skyward is a platform that we calculate students' grades and attendance, as well as how we capture all information about a student. We ask that you go into the Skyward Family Access portion of our website and get an account. It is simple, it is easy, and it gives you a wealth of information. And it's a way to help you track your students and their progress. You can go to our website at midlandisd.net/skyward, look for Skyward Family Access, plug in, give the information, and you are on board. Remember your password. That's one of the biggest things that people forget. Remember your password. Leading into Wi-Fi, really pleased about what we've done in regards to navigating Wi-Fi and technical resources, primarily Chromebooks. Our Wi-Fi resources are getting out into our community in a number of ways. Again, I applaud the city and what they've done to boost their Wi-Fi and their park areas, what we've done to boost Wi-Fi in 9 of our buildings to push out into the parking lots, from buses to devices. You've heard us talk about 21st century learning, and everyone has always asked, what is 21st century learning and what does it look like? Well, you're in it right now. Our kids have been waiting for us to get to this 21st century learning in 2020 for a long time. And to see not just the device output of what that looks like, but the instructional output for what that looks like. I've heard from the university level, even all the way down to our level, that kids are working harder and professors and teachers are working harder out of the classroom than they were in the classroom. So we got to get some balance around that because it's new for a lot of us, but we are pushing what this 21st century learning could look like in our future. We're pushing 21st century resources, whether it be Wi-Fi and computers, out to kids so they can learn at their own pace. And we're finding that the pacing is different for everyone. When you have 22 kids in a classroom, everyone tries to stay at the same pace. And now that we're able to go outside the classroom, we can navigate pace in a very, very different way. So those who are really ready to rapidly accelerate, how we can meet that need. Those who have gaps to cover, how we can meet that need. It's new and it's different. It's going to take some adjusting to get used to, and we're seeing that right now. It's radically different, but I think absolutely this is a path that we need to think about as we drive into our future. I would tell you that I've shared this conversation at a national level, I've shared it at a local level, regional level, state level, that we cannot put all this effort forward and not do something with it, and in essence, put it on a shelf and save it for another day. Currently, right now, we have 1,300 hotspots that have been distributed to campuses and are going to go out to our students so that they can navigate what access in the home looks like. So that's the digital divide that's going to occur, happens through this way. We distributed 2,800 Chromebooks, have been checked out to parents who have a need for a device in their home, so that you can, in essence, have your textbook and it's coming via the Chromebook. Our Wi-Fi buses are in the community Monday through Friday at our county meal locations from 8:30 to 12:30. We've had over 42 people walk up daily to the buses, and 20 cars drive up to the buses as well. We knew there was a need, and we jumped out to facilitate what that need looks like for students and parents. And if you're having any trouble, because we know that that does happen, happens in a variety of ways. If you're having any trouble with the program, with the classroom, navigating whatever it might be on the technical side, we have the technology line helpline that is set up. That number is 432-240-1110. That's 432-240-1110. And we have someone who's there from 8 to 5, Monday through Friday. In the first week, we helped about 50 callers. Now we're seeing about 40 calls a day. The line is manned by an incredible staff member who speaks English and Spanish, so we can navigate it in multiple platforms and able to help you in that regard. I would just share, if you call, because it's a single individual and you're not getting a response, call back, please, because she is there and she's ready to help you. On the food side, if you're finding that you need another type of resource at this point, in the form of meals, we know that you're still out there, and with that regard, we've not stopped serving kids. We've served over 300,000 meals today. And maybe you have someone who's been on a free and reduced lunch platform before, and there's or a job loss or an illness in the family. Please seek out what those meals are for your kids. We have all the locations. You can go to our website. You can find where the nearest location is to you, so that we can get you that resource. That's what it's there for. It's for kids 18 and under. It's a grab and go. Please make that your option. We are asking that when a parent does drive up without any students, it's an adult by themselves. We have some documentation that we need to have in order to get through the auditing process for the Texas Department of Agriculture. So we ask you on the form to list the kids that you are picking lunches up for. Not just your kids, but list the kids that you are the guardian and responsible party to come pick up these meals, to let us know who those are. So when we're asked, we have that information. I would ask that we move to a single meal pickup time for breakfast and lunch from 10:30 to 12:30. We've been doing it now fluidly for a good several days. And I appreciate all the effort our community has made to adapt along with what that has looked like. On another front, you've heard graduation. That's a big platform for our kids and an item that we have to get ready for. And at this point in time, you know that we are not going to have graduation in the formal sense. Getting 650 on average with the two bigger high schools and putting 7,000 people in an arena. At this state, that is not something that's coming forward. We're taking information and we want to know. We've sat and listened from individuals from around the region again, around the state, around the country, around the world. We're gathering information as well about what this whole process looks like on the educational side. And with graduation, we want to hear from our parents. And so we've set up on our Seniors 2020 website a way for you to provide feedback. And we've heard a number of them, either via email, phone calls, and we'll get this out as well. And we're going to address something that makes it the next best option that we can provide for our students. Our students have worked very diligently and hard since pre-K or kinder to get to this point. And we want to provide this this pivotal moment in a form or fashion for our seniors. So our seniors, you are on our mind. We are working through what that looks like. And I'm with you through this, parents, because I've got a senior in my home who potentially is not having two formal graduations and will have some one form of a graduation on the MISD side. And so having all that understanding of what that looks like to get to this point for this generation of students who has been clearly under attack from the very beginning as they entered under 9/11, as they have all the tragedy that has happened throughout their school career, and then have now at the end of that time, the COVID-19 in regards to memory of how their educational side has gone. Parents from seniors, please reach out to us. Again, if you can go to our midlandisd.net/seniors2020, go to the commencement 2020 section, and there you'll be able to provide information. So whether it be, drive-in and cautious about a parade. So those of you who think that we could put 650 kids in cars and drive somewhere, that a lot of logistics, a lot of concerns wrapped around that. But whether it be some form of a stage, some form of picture taking, some form of an intimate time with your student and a parent done in a social distancing way, to what it is to prescribe a self video from a student that gets brought to us and loaded. We're looking at a number of factors on how we can drive what that looks like. With that, I will take it to questions.
All right, the first question is, out of the 2,800 Chromebooks, are those issued to individuals or are they being shared? If so, do you have more available?
We do have more available, and we took it from a number of ways on round one. So if we had a family that had several kids, we wanted to be sure that we got the distribution out on a needed base first. So we would put one in the home. If the family returned that they needed a second device, we provided what that could look like. So if you had multiple kids in the home, you had one device initially. If you needed another device, we could get you another device. And so I don't have if that's individual or family in a home. So if there's two students in a home, it could be one device and not a device for each student. But if you had 3 or 4 or 5, it could be multiple devices in a home, knowing that the difficulty to have 3, 4, or 5 students trying to get in at some point in time on their best learning moment would be a difficult piece. But I don't have it broken down by, is it at home or is it individual family?
And the next question is from a parent. Why are we being told that students are being graded on work when you have said multiple times it was not going to be graded? And why are we being threatened that our children may not advance a grade level for not completing elective assignments?
So that's a conversation you need to take back to your campus level, because you've heard it from me that we are not taking grades, but we are doing progress monitoring for what it looks like to see how students are performing. And we've shared that comes in a form of not on track, or incomplete. So if you're on track, it means that you've done everything within the first semester, the first 4 or 6 weeks, and you are working through completing the assignments that your teachers are issuing right now, and the feedback that you're getting showing that your student is progressing forward. Not on track means that we need to think through why a student is not progressing forward, what's hindering it, whether it be in home, some social emotional issue, or if it be some other factor of I just don't have a learning for what the assignments are being, how they're being generated, and how can we approach that student either into summer learning or currently right now. Incomplete means you've done nothing. You did nothing the first semester, you've done nothing now. Those are the conversations that campuses and teachers have to have in regards to the student and their progress moving forward. Those are challenges that we're going to have to meet along that way. So if your teacher is saying that this is for a grade and you are submitting it for a grade, we have 1,600 teachers. The conversation is it's for feedback so we can have an understanding for what you're doing with your assignment and how your assignment is progressing forward. So reach back out to your campus principal. There's not a threat around this. It is simply understanding where your student is. And if you're being threatened in some form or sense, please don't take it that way and reach out to your campus principal. That's the first place that I would go to if I felt that my student was progressing, but the information and feedback was differently. Let's collaborate together around that and around where your student is.
Okay, I'll give them just a few seconds to see if anyone has any questions. All right, thank you.
All right, you've got it.
With that, we will turn it over to Judge Johnson.
Good morning. I want to start off by saying thanks to everybody that's in public service. And by that, I mean those that are maintaining our roads, keeping our trash picked up, and ensuring that every time we open a faucet or turn on a faucet, we get water. At times like this, it takes every one of us to keep our community going. I'd like to announce that beginning this Monday, we'll be having our Commissioner Court meeting in person here at the courthouse. And the purpose for this is simple. We've got an obligation to you, the people of Midland, to do the work of the citizens of Midland. There are times we must do this work in person. And one example is during our executive sessions. We've heard stories of Zoom being hacked, and this is just not anything we can risk during these kinds of deliberations. We'll be practicing social distancing and adhering to disinfectant areas. Governor Abbott began the process of beginning to open our economy engine back here. We got a long way to go, and it'll be a slow process, but we will succeed in bringing it back. Not just to a new normal, but to a more invigorated economy. I'm convinced of this. I'm supportive of our nation's strength and economy. I'm convinced we should do all we can to invigorate our state's economy, but my heart and soul is here in Midland's economy. As a businessman here in Midland for over the last 40 years, I worked under two slogans, one of them being the sky's the limit, more recently by the basin. These slogans are at my very core. Having said this, I'm going to be presenting to our court a resolution to buy local, build local. This resolution should authorize an evaluation of all products as well as services that are purchased from non-local suppliers for use here in the county, by the county. Where these products and services can be purchased locally and within contractual terms, I'm going to ask that we proceed as soon as possible. My hope is that we can rebuild Midland's economy by buying local and building local, and this is going to get our citizens back on our feet a lot sooner than later. And then also in closing, chat's averaging since we kicked it off a 3.5% systems response. This is a positive sign, but more people can provide us with more information. This information will be a tool to help in the decisions that we must make to open up our community. But just as importantly, it's going to guide us later in the year when our regularly scheduled flu season fires up. So if you would, please text the word chat or chat ESP for Spanish version to 432-287-7337 and just answer 3 simple questions. Then every Monday, Wednesday, and Friday, you'll only be answering 1 question. And as always, you are anonymous. So with that, I'm complete with today's report. If there's any questions, I'll be glad to answer.
The first question from Stuart is how many people are on chat?
As of right before starting right now is 936.
Okay, let me see if any others come in. Judge Johnson, thank you.
Thank you.
Mayor Payton.
Well, good morning to everyone. Thank you again to everybody who has been keeping us up to date. Hospital, school district, county, judge, thank you for everything you're doing. And I already talked to her this morning, but a huge shout out to Erin Bailey, who has been in a new world and had to handle all the communication for everything that's going on, as well as late night texts from me and early morning texts saying, how about this? So thank you, Erin, for everything you're doing. And also all of you who are involved in getting information out. Not a lot new to report to you, except we have been planning for what it might look like for us to open up. Actually, let me correct that, not what it might look like, but what it will look like for us as a city to begin the process of opening up. I already have a plan that has been worked on. I've been working on that plan with various mayors from around the area, as well as putting this plan in front of the governor as much as I could. We have conversations this afternoon with taxing entities and all of those who are involved in trying to get things to our new normal and get us opened up. Those conversations are taking place, and we're being as patient as we can possibly be, waiting to see what the governor will do as we wait for either more announcements tomorrow or more announcements Monday. I've been in contact with leaders in Austin on phone calls yesterday, we'll be on phone calls this afternoon. Again, tomorrow, we're talking to our U.S. representatives and senators about things that can be done here in the basin. It will be a process, as the judge alluded to. We will not be able to just open the floodgates to go back to life as normal. And quite frankly, I don't think everybody will go back to life as normal that fast, as people will still be concerned about their health and, more importantly, even the health of others. But we will have a process to get things open. And so be patient with this, because I know you're continuing to be patient. And just a huge thank you, especially to our small businesses that somehow have been categorized through this process as non-essential. And then you're finding out that the quote unquote essential businesses have been able to sell all the things that you haven't been able to sell. So thank you for your patience. And hopefully by the time we get into early next week, we'll already be down this process of getting this community open. I'll be going into a little more detail about what the plan looks like for us to open up later on tonight on Facebook Live at 8 o'clock. In the meantime, two more things. Continue to do the things you're doing. I know we sound like a broken record, but continue to practice the social distancing and taking care of yourselves. Being careful when you're out at the grocery stores, especially being very conscientious of our more susceptible populations. And then finally, many of you have emailed me and emailed us at the city related to confusion about your online accounts and about water and your water being turned off. And there's a high degree of nervousness whenever these kind of this lack of communication takes place. And I take full responsibility for that. And I hope you'll go to our website at the city and see the video that's been provided to help you understand what's happening with new accounting that's taking place as far as being able to pay your bill online. I know many people have worried that their water is going to be turned off. That's not the case. We're going to be taking care of you as a city. We're in difficult times, and sometimes we just don't communicate as quick as we could and as maybe quick as we should have. So I take responsibility for that, and hope that you'll be able to find your answers and work through the process digitally. You can still pay your bill other ways, but if you want to go online and look at that video, you can hopefully get some of your questions answered. So with that, Erin, that's pretty much my report. Happy to take any questions.
Okay, nothing yet. Let me see if any come in.